Herpes virus infections are the most common STD, so it's by far the most important or the most prevalent of all STDs. Herpes simplex is a virus infection, and it's categorized, really broken down into two types: herpes simplex type 1, which is generally in the mouth and above the waist, and then there's herpes simplex type 2, which is generally considered genital herpes. Although, interestingly, either type of herpes virus, 1 or 2, can be in each of the different locations. The virus actually never leaves your body. It resides in the nerves that supply the skin sensation, and so you're always infected, although the disease is not active. And that's true for both herpes simplex type 1 and herpes simplex type 2. Anywhere from actually 2 days to 10 days after exposure, there will be a red spot will form, there might be some tingling or burning, and then a blister will form. Generally after a week or two, it resolves. If you have medication at that time period, it will resolve a bit faster. First infection is generally the worst. Each successive outbreak, your immune system becomes more efficient at taking care of the problem. And so eventually, in most people, herpes infections just sort of wane and eventually disappear. A few people are unlucky. They'll have outbreaks throughout their life. The recurrence rate, it can be anywhere from a few every month or two to never to once or twice a year. The trigger factors of herpes simplex type 1 are stress, anxiety, immunosuppression, just general illness, sun exposure. The other thing that can trigger it too is trauma, certainly from either an accident, an abrasion or a cut, or in some cases within a dermatology office, some people who would have, for instance, fillers or injections of various sort or laser resurfacing or chemical peels. These people, if they have a history of herpes virus infection, they're always given medication beforehand to either minimize or prevent the infection from coming out. Vast majority of people with herpes simplex type 2 or genital herpes are infected without their knowledge, or they don't know what they have, and nor do they seek treatment. 20% of them at any given time are shedding virus without a sore or an ulcer or any symptoms at all. So they don't know they have the disease, and basically 1 out of 5 days they're shedding virus, infecting potentially other people. If you would be immunosuppressed, a herpes virus infection, instead of just staying in one little spot, as the culture that comes and goes over time, what would happen is that can spread over a large area. It could spread over large parts of the skin. It can occur onto an eye. A serious consequence of herpes type 2 infection in women is if they happen to have an active lesion or shedding virus asymptomatically and they give birth, their newborn child will be inoculated over their entire surface, all their skin, especially their eyes, with herpes virus. And that herpes virus infection can be life-threatening and is a medical emergency. It's a condition that's taken so seriously and it's so potentially devastating that if there is any question of herpes virus infection activity or shedding asymptomatically, they'll do a C-section rather than do a normal delivery, just to make sure there's no chance of there being any infection of the newborn. You can't ever cure it, but there are several medications that have been developed in the last really 20 to 30 years that are very, very effective. The most common medication that is used is a drug called acyclovir. There's 2 other later medications. One is called Valtrex, one is called Fambir. And these are medications that can very easily control the symptoms and decrease the amount of time one has active, lesions or blisters in case of herpes virus infections.